Hi, welcome to our channel of ignou audiobooks, Indira Gandhi National Open University, School of Social Sciences, SOSS, Master's Degree Programs, MA in Psychology, MAPC, Second Year, MPCE 0 to 1 Counseling Psychology, Block-4 Counseling for Unit-3 Gender Identity Disorderal Disorders, Unit-3 Gender Identity Disorder, 3.0 Introduction. In this unit, we will be dealing with gender identity disorder. We start with definition and description of gender identity disorder and follow it up with origin of gender identity disorder and transgender issues. Then we take up components of gender identity disorder and elucidate criteria and diagnosis of gender identity disorder. Then we enlist the symptoms of gender identity disorder and present the causes of gender identity disorder. Finally, we take up the treatment of gender identity disorder and indicate the action steps in treatment for gender identity disorder. 3.1 Objectives. After completing this unit, you will be able to define and describe gender identity disorder, trace the origin of gender identity disorder, elucidate the components of gender identity disorder, explain the criteria for diagnosis, delineate the symptoms of gender identity disorder, discuss the causes, and describe the treatment interventions of gender identity disorder. 3.2 Definition and description of gender identity disorder. Gender identity, a basic feature of personality, refers to an individual's feeling of being male or female. Children become aware that they are male or female at an early age, and once it is formed, their gender identity is highly resistant to change. Gender identity disorder, GID, is a condition in which a person has been assigned one gender, usually at birth, but identifies as belonging to another gender, or does not conform with the gender role their respective society prescribes to them. It is a psychiatric term for what is widely known by other terms such as transsexuality, transgender, transvestism or cross-dressing. This disorder is different from transvestism or transvestic fetishism, where cross-dressing occurs for sexual pleasure, but the transvestite does not identify with the other sex. Transsexualism should also not be confused with the behavior of drag queens and drag kings. Also, transvestic fetishism usually has little, if anything, to do with transsexualism. As a general rule, transsexual people tend to dress and behave in a manner consistent with the gender with which they identify. 3.3 Origin of gender identity disorder. During the 1950s and 60s, psychologists began studying gender development in young children, partially in an effort to understand the origins of homosexuality, which was viewed as a mental disorder at the time. Psychoanalyst Robert Stoller is credited with introducing the term gender identity, and behavioral psychologist John Money was also instrumental in the development of early theories of gender identity. His work popularized an interactionist theory of gender identity, suggesting that, up to a certain age, gender identity is relatively fluid and subject to constant negotiation. Sigmund Freud also had a unique theory for the development of gender identity. He believed it was developed during the phallic stage of development. During this time, young boys develop an Oedipus complex and young girls an Electra complex. Freud believed that during this time, the child has an unconscious, sexual desire for the parent of the opposite sex and jealousy or hatred for the same-sex parent. That jealousy eventually turns into emulating, and the child wants to be like that parent, eventually identifying with it. The notion of gender identity appeared in the Diagnostic and Statistical Manual of Mental Disorders in its third edition, DSM-3, 1980, in the form of two psychiatric diagnosis of gender dysphoria, gender identity disorder of childhood, GIDC, and transsexualism for adolescents and adults. The 1987 revision of the manual, the DSM-3R, added a third diagnosis, gender identity disorder of adolescence and adulthood, non-transsexual type. This later diagnosis was removed in the subsequent revision, DSM-4, 1994, which also collapsed the GIDC and transsexualism in a new diagnosis of gender identity disorder. 3.3.1 Transgender. There are many political points of view in the literature of transgender, but the generally agreed definition of transgender covers everything that does not fall into society's narrow terms of man and woman. Some of the people who consider themselves as transgendered would include transsexuals, who may or may not have had sex reassignment surgery, transvestites, who wear clothing and adopt behavior of the opposite sex, people with ambiguous genitalia, and people who have chosen to perform either an ambiguous gender role or no gender role at all. There are four main categories in the study of transgender. 1. Essentialist or naturalist. This group believes that there is no difference between sex and gender, that there are only two genders, and these cannot be changed. 2. Social constructivist. This group believes sex and gender can only be considered as part of a social interaction. In other words, sex and gender are a construction assigned by society. 3. Performance. Gender performance theorists believe gender is best understood through performance studies, and they look at what is revealed from clues such as body position, gesture, facial expression, proximity, voice, modulation, speech pattern, social space, clothing, adornment and cosmetics. 4. Memory and language generation. This group looks at the body as the expression of the symbols of words, gestures, and a larger cultural language. On a gut level, the body has deeper knowledge that may not be registered by the mind. While transgender theorists do not always agree on definitions and underlying philosophies, this is an emerging field with many avenues for scholarly and political dialogue. As the study of transgender develops, it will influence many other disciplines such as anthropology, psychology, psychiatry, sociology, women's studies, men's studies, and gender studies. A gender identity disorder causes the person to experience serious discomfort with his/her own biological sex orientation. The gender identity disorder can also causes problems for the person in school, work, or social settings. The need for treatment is emphasized by the high rate of mental health problems, including depression, anxiety, and drug and alcohol addiction, as well as a higher suicide rate among untreated transsexual people than in the general population. Many transgender and transsexual activists and many caregivers point out that these problems usually are not related to the gender identity issues themselves, but to problems that arise from dealing with those issues and social problems related to them. 3.4 Components of gender identity disorder. People with gender identity disorder frequently report their feelings as having always been there, and the disorder can be evident in early childhood. Most people know whether they have a gender identity problem by the time they reach adolescence, although in some cases it seems to appear in adulthood. Gender identity disorder is a diagnosis given to persons who meet a certain number of clinical criteria related to feelings of discontent regarding one's biological sex and identification with the opposite biological sex. The individual may identify to the point of believing that they are, in fact, a member of the other sex who is trapped in the wrong body. There are two components of gender identity disorder, both of which must be present to make the diagnosis. I. There must be evidence of a strong and persistent gross gender identification, which is the desire to be, or the insistence that one is, of the other sex. This cross-gender identification must not merely be a desire for any perceived cultural advantages of being the other sex too. There must also be evidence of persistent discomfort about one's assigned sex or a sense of inappropriateness in the gender role of that sex. Gender identity disorder can affect children, adolescents, and adults. Individuals with gender identity disorder have strong cross-gender identification. They believe that they are, or should be, the opposite sex. They are uncomfortable with their sexual role and organs and may express a desire to alter their bodies. While not all persons with gender identity disorder are labeled as transsexuals, there are those who are determined to undergo sex change procedures or have done so, and therefore are classified as transsexual. Adults with gender identity disorder sometimes live their lives as members of the opposite sex. They tend to be uncomfortable living in the world as a member of their own biologic or genetic sex. They often cross-dress and prefer to be seen in public as a member of the other sex. Some people with the disorder request sex change surgery. 3.5 criteria for gender identity disorder, according to the American Psychiatric Association and the Diagnostic and Statistical Manual of Mental Disorders 4, DSM-4, the following criteria must be met before a person can be given the official diagnosis of gender identity disorder. There must be evidence of strong and persistent cross-gender identification. This cross-gender identification must not merely be a desire for any perceived cultural advantages of being the other sex. There must also be evidence of persistent discomfort about one's assigned sex or a sense of inappropriateness in the gender role of that sex. The individual must not have a concurrent physical intersex condition, example, androgen insensitivity syndrome or congenital adrenal hyperplasia. There must be evidence of clinically significant distress or impairment in social, occupational, or other important areas of functioning.
The DSM-IV also provides diagnostic criteria for gender disorders that do not meet the criteria for the general gender identity disorder diagnosis. The following criteria are sufficient for a diagnosis of gender identity disorder in children as well as for gender identity disorder not otherwise specified, GIDNOS. For the former diagnosis, criteria must be identified before a person is 18 years of age. A. Intersex conditions, e.g., androgen insensitivity syndrome or congenital adrenal hyperplasia, and accompanying gender dysphoria transient, stress-related cross-dressing behavior. Persistent preoccupation with castration or penectomy without a desire to acquire the sex characteristics of the other sex, which is known as Coptic syndrome. Cross-gender identification, not merely a desire for any perceived cultural advantages of being the other sex. In children, the disturbance is manifested by 4 or more of the following. 1. Repeatedly stated desire to be, or insistence that he or she is, the other sex. 2. In boys, preference for cross-dressing or simulating female attire. In girls, insistence on wearing only stereotypical masculine clothing. 3. Strong and persistent preferences for cross-sex roles in make-believe play or persistent fantasies of being the other sex. 4. Intense desire to participate in the stereotypical games and pastimes of the other sex. 5. Strong preference for playmates of the other sex. 6. In adolescents and adults, the disturbance is manifested by symptoms such as a stated desire to be the other sex, frequent passing as the other sex, desire to live or be treated as the other sex, or the conviction that he or she has the typical feelings and reactions of the other sex. B. Persistent discomfort with his or her sex or sense of inappropriateness in the gender role of that sex. In children, the disturbance is manifested by any of the following, as for instance in boys, assertion that his penis or testes are disgusting or will disappear, or assertion that it would be better not to have a penis, or aversion toward rough and tumble play and rejection of male stereotypical toys, games, and activities. In girls, rejection of urinating in a sitting position, assertion that she has or will grow a penis, or assertion that she does not want to grow breasts or menstruate, or marked aversion toward normative feminine clothing. In adolescents and adults, the disturbance is manifested by symptoms such as preoccupation with getting rid of primary and secondary sex characteristics, e.g., request for hormones, surgery, or other procedures to physically alter sexual characteristics to simulate the other sex, or belief that he or she was born the wrong sex. C. The disturbance is not concurrent with a physical intersex condition. D. The disturbance causes clinically significant distress or impairment in social, occupational, or other important areas of functioning. Specify if, for sexually mature individuals, sexually attracted to males, sexually attracted to females, sexually attracted to both, sexually attracted to neither. 3.6 Symptoms of gender identity disorder. Symptoms: a strong and persistent cross-gender identification, not merely a desire for any perceived cultural advantages of being the other sex. In children, the disturbance is manifested by 4 or more of the following. 1. Repeatedly stated desire to be, or insistence that he or she is, the other sex. 2. In boys, preference for cross-dressing or simulating female attire. In girls, insistence on wearing only stereotypical masculine clothing. 3. Strong and persistent preferences for cross-sex roles in make-believe play or persistent fantasies of being the other sex. 4. Intense desire to participate in the stereotypical games and pastimes of the other sex. 5. Strong preference for playmates of the other sex. In adolescents and adults, the disturbance is manifested by symptoms such as a stated desire to be the other sex, frequent passing as the other sex, desire to live or be treated as the other sex, or the conviction that he or she has the typical feelings and reactions of the other sex. Persistent discomfort with his or her sex or sense of inappropriateness in the gender role of that sex. The disturbance is not concurrent with a physical intersex condition. The disturbance causes clinically significant distress or impairment in social, occupational, or other important areas of functioning.
Gender identity disorder in children is often reported as having always been present, and persons with the disorder do not remember a time when they were satisfied with their gender. Other persons with the disorder report that symptoms began in adolescence or adulthood and seemed to grow in intensity over time. There is usually strong and persistent preferences for cross-sex roles in make-believe play or persistent fantasies of being the other sex, an intense desire to participate in the stereotypical games and pastimes of the other sex, and usually a strong preference for playmates of the other sex. Issues regarding gender identity can manifest in a variety of ways. For example, some people may cross-dress, while others may seek a sex change surgery. Below is a list of other common symptoms of gender identity disorder. Children times express a desire to be the opposite sex, times find their genitals or indicators of their gender cross, times believe that they will grow up to become the opposite sex, times are often rejected by their peers, times become isolated and shy, times develop moderate to severe anxiety, times present low self-esteem, times drop out of school, times develop moderate to severe anxiety. In adolescence, there is a preoccupation with getting rid of primary and secondary sex characteristics, example, request for hormones, surgery, or other procedures to physically alter sexual characteristics to simulate the other sex. Adults times desire to live as a person of the opposite sex, times pursue a sex reassignment operation, times both dress and act in a way that is indicative of the opposite sex, times become socially isolated or ostracized, times develop moderate to severe depression, times develop moderate to severe anxiety. Some persons with gender identity disorder have genitalia and secondary sex characteristics in line with their biological sex. Others may have ambiguous genitalia or are hermaphroditic. Not all transsexual persons who dress or act as persons of the opposite gender, have gender identity disorder. Generally, homosexuals do not have gender identity disorder. The majority of homosexuals identify strongly with their biological gender. Homosexuality involves only a sexual attraction to persons of the same gender. 3.7 Causes of gender identity disorder. John Money has coined a useful term, gender maps, to describe the phenomenon of gender identity. He defined gender map as the entity, template, or schema within the mind and brain that codes masculinity and femininity and androgyny. This map or coding imprint is established very early in life through an interaction of nature and nurture. Because gender map development is highly influenced by hormones emanating from the developing fetus, sex and gender identification are generally closely matched. But like most aspects of being human, there are no guarantees. As a result, an individual may, as early as the age of 4, find themselves aware of being caught between having the anatomy of one sex but being equipped with a gender map much more typical of an individual of the opposite sex. It is also apparently possible for an individual to have no clear sense of gender whatsoever. There is no clearly understood cause for gender identity disorder. The biological theory is based on evidence that high levels of the male hormone, testosterone, are associated with high levels of aggression in boys and tomboyishness in girls. Social learning theory proposes that gender typing is the result of a combination of observational learning and differential reinforcement. Cognitive developmental theory states that gender understanding follows a prescribed timeline. The pattern put forth is that children recognize that they are either boys or girls by the age of 2 or 3, followed shortly by recognition that gender is stable over time. By the age of 6 or 7, children understand that gender is also stable across situations, no matter what theory one adopts. For most children, whose sex and gender map are congruent, this insight typically goes unnoticed. However, if there is sex-gender map incongruence, the child is left perplexed about his or her gender status and begins a lifelong, often compulsive search for resolution of the discrepancy. All children naturally comply with the demands of their internal sense of gender. Boys generally express male behavior and girls generally express female behavior even when raised in closely monitored gender-neutral conditions. If there is any confusion in the child, he or she quickly learns from adults and peers that certain gender expression behaviors are inappropriate for that individual. This is true even of gender dysphoric children. Some gender dysphoric children internalize their dilemma and make heroic efforts to display the gender behavior expected of them, while expressing their internal sense of gender through secret, play, cross-dressing, and cross-gender fantasies. Others may continue to struggle by insisting that they be allowed to openly express maleness or femaleness, irrespective of their assigned sex. Either way, the problem becomes subsumed into the child's personality. The arrival of adolescence increases the difficulties for people who are gender dysphonic. Without fail, the subsequent development of secondary sex characteristics counter to the individual's desires increases anxiety. Often, frustration sets in, and determination to finally resolve the problem becomes the individual's driving force in life. This is especially true for gender dysphoric males. Since the obvious first effort is to accept the physical evidence of their genitalia as reality, it is very common to see many of these people push through these early years of adulthood by engaging in stereotypical, even supermale, activities. Since outward behavior has no permanent influence on internal gender understanding, these activities serve only to complicate the individual's social involvement resulting in anxiety about expressing his true felt gender. This anxiety state is characterized by feelings of confusion, shame, guilt, and fear. These individuals are confused over an inability to handle their gender identity problem in the same way they readily handle other problems in life. They feel shame over an inability to control what they believe society considers to be sexually perverse activities. Even though cross-dressing and cross-gender fantasies provide much-needed temporary relief, these activities often leave the individual profoundly ashamed of what she or he has done. Closely associated with shame is guilt over being dishonest by hiding secret needs and desires from family, friends, and society. For example, people commonly get married and have children without telling their spouse of their gender dysphoria before making the commitment. Typically, it is kept secret because they have the mistaken conviction that participation in marriage and parenting will in itself erase their gender dysphoria. All of this then leads to fear of being discovered. With some justification, gender dysphoric people fear being called sick, uncaring, selfish, and even being left alone by the people they love the most. The psychological diagnosis of gender identity disorder, GID, is used to describe a male or female who feels a strong identification with the opposite sex and experiences considerable distress because of his or her actual sex. Thus, gender identity disorder can affect children, adolescents, and adults. Individuals with gender identity disorder have strong cross-gender identification. They believe that they are, or should be, the opposite sex. They are uncomfortable with their sexual role and organs and may express a desire to alter their bodies. While not all persons with GID are labeled as transsexuals, some are determined to undergo sex change procedures or to pass socially as the opposite sex. Transsexuals alter their physical appearance cosmetically and hormonally, and may eventually undergo a sex change operation. Children with gender identity disorder refuse to dress and act in sex stereotypical ways. It is important to remember that many emotionally healthy children experience fantasies about being a member of the opposite sex. The distinction between these children and gender identity disordered children is that the latter experience significant interference in functioning because of their cross-gender identification. They may become severely depressed, anxious, or socially withdrawn. Psychologists who work with children and teens on gender identity note that cross-gender behaviors generally become less overt with time, and by late adolescence, GID is usually no longer present. Long-term studies of children referred to a specialty clinic for GID show that cross-gender behavior is tolerated in girls to a far greater degree than it is in boys. Thus, parents are quicker to bring boys in for evaluation. The clinicians who conducted the study theorized that girls may be under-referred for GID because there is more social tolerance of tomboys than there is of sissies. While much more research is needed, scientists theorize that there are other social factors in play as well. It is much more common for males to wish to cross to the female gender, but there are exceptions. In Poland, the ratio of women who wish to change gender is 5 times the rate of men who wish to change. Researchers theorize that Polish women face unfavorable living conditions and gender-related economic and occupational hardships to a degree that they seek relief by changing gender. The biological causes of gender identity disorder are not known. According to one theory, a prenatal hormonal imbalance may predispose individuals to the disorder. Problems in the individual's family interactions or family dynamics may play a part.
3.8 Treatment of Gender Identity Disorder. Treatment for children with gender identity disorder focuses on treating secondary problems such as depression and anxiety, and improving self-esteem. Treatment may also work on instilling positive identifications with the child's biological gender. Children typically undergo psychosocial therapy sessions. Their parents may also be referred for family or individual therapy. Children and adolescents with GID have never been systematically counted, but gender identity disorder is generally regarded as a rare phenomenon. In Europe, there are treatment centers in London, England, Utrecht, the Netherlands, and in Frankfurt, Germany. In North America, patients may seek treatment at special centers for gender identity disorder in Toronto, in New York City, at the University of California, Los Angeles, at Johns Hopkins University in Baltimore, and at Case Western University in Cleveland. The larger number of GID patients in North America may be related to a less permissive attitude toward gender nonconformity. Traditionally, Europe is more tolerant of gender nonconformity, and parents are less likely to see their children's GID symptoms as requiring treatment. With adolescents, there are many variations in gender role behavior, and experienced gender identity specialists avoid making premature decisions, particularly when sex reassignment surgery is under consideration. One study described in a review in the American Journal of Psychotherapy showed that a large number of children with GID grow up to be homosexual or bisexual. The concept of treatment for GID children and adolescents has become highly politicized, since some groups fear that treatment of GID is actually a thinly veiled attempt to curb or even prevent homosexuality. Hormone and surgical treatments. Transsexual adults often request hormone and surgical treatments to suppress their biological sex characteristics and acquire those of the opposite sex. A team of health professionals, including the treating psychologist or psychiatrist, medical doctors, and several surgical specialists, oversee this transitioning process. Because of the irreversible nature of the surgery, candidates for sex change surgery are evaluated extensively and are often required to spend a period of time integrating themselves into the cross-gender role before the procedure begins. Usually, sex reassignment surgery is not offered to anyone under 18. Before surgery can be considered, candidates undergo at least a year of psychotherapy. A real-life test of living for at least a year as a member of the desired gender is recommended. A male who has been cleared for surgery will have a vaginoplasty, the surgical technique for creating a neo-vagina. The penis and testes are removed. Surgeons permanently remove male hair growth and perform corrective plastic surgery on the larynx. For the patient to successfully pass as a woman, the growth of facial and body hair must be suppressed, and this can be accomplished with a drug such as cyproterone acetate. The surgery for changing a man into a woman is simpler than the surgery for changing a woman into a man, and many more men than women undergo sex change operations. A woman who has been cleared for surgery will undergo surgical removal of the breasts, uterus, and ovaries. In some cases, a phalloplasty will be performed, creating a neophallus. Premenopausal women who receive sex change operations are given a drug such as linestrenol to suppress menstruation. Long-term follow-up studies have shown positive results for many transsexuals who have undergone sex change surgery. However, significant social, personal, and occupational issues may result from surgical sex changes, and the patient may require psychotherapy or counseling. Breasts, uterus, and ovaries. In some cases, a phalloplasty will be performed, creating a neophallus. Premenopausal women who receive sex change operations are given a drug such as linestrenol to suppress menstruation. Long-term follow-up studies have shown positive results for many transsexuals who have undergone sex change surgery. However, significant social, personal, and occupational issues may result from surgical sex changes, and the patient may require psychotherapy or counseling. Treatment of psychological disorders in GID. According to the American Psychological Association, the transgendered suffer from a higher than average rate of depression, anxiety, suicide, and self-mutilation, yet rarely seek treatment. Untreated gender identity disorders may manifest in associated disorders and emotional distress that can interfere with the individual's ability to function socially at school and work or in relationships. Treatment helps a patient achieve and maintain a healthy and stable life.
For children with GID, individual and family counseling, along with social and physical interventions are recommended. Children with gender identity disorder, may develop symptoms of depression, generalized anxiety and separation anxiety disorder. Adolescents may be at risk for depression, suicidal thoughts or suicide attempts. Counseling should focus on improving self-esteem and treating associated complications. Parents are encouraged to allow their child to explore fantasies about being a member of the opposite gender in a safe and tolerant environment. Additionally, parents are offered suggestions such as using gender-neutral language, making gay-friendly media available, and encouraging the child to participate in any activities she or he is interested in without judgment. Other psychological techniques that attempt to alter gender identity to one considered appropriate for the person's assigned sex have typically been shown to be ineffective. However, psychological therapy can help alter the course of gender identity disorder problems and can be critical in helping the person adjust. Today, most medical professionals who provide transgender transition services now recognize that when able to live out their daily lives with both a physical embodiment and a social expression that most closely matches their internal sense of self, transgender and transsexual individuals live successful, productive lives virtually indistinguishable from anyone else. Counseling individuals with gender identity disorder should include an understanding of the differences between true transsexualism and other disorder issues such as transvestic fetishism, nonconformity to stereotypical sex role, behaviors, gender dysphoria, and homosexuality. Patients and their families need to be educated about the complexities of these issues, the enduring nature of these disorders, and the challenges that gender disorders typically present. Multifaceted therapeutic approach. When GID is diagnosed in an adult, a multifaceted therapeutic approach begins. In addition to support groups and counseling, both individual and couples counseling, patients may choose hormone therapy, undertake a real-life experience, living full-time in their desired gender for a year or longer, and gender reassignment surgery. Patients desiring gender reassignment surgery undergo extensive evaluation, therapy and a transition period before they can be approved for surgery. It is generally accepted that a reasonable and effective course of treatment for transsexual people can be sex reassignment therapy. This can include hormonal treatment and surgery. Sex reassignment surgery consists of procedures which transsexual women and men undergo in order to match their anatomical sex to their gender identity. While genital reassignment surgery, GRS, refers only to surgeries that correct genital anatomy, sex reassignment surgery, SRS, may refer to all surgical procedures undergone by transsexual patients. Hormone therapy may also be helpful. In male to female individuals, original sex characteristics can be suppressed and breasts, increased body fat and a more feminine body shape can be promoted. In female to male individuals, facial and body hair promotion may be achieved with testosterone. Transgender transition services, the various medical treatments and procedures that alter an individual's primary and/or secondary sexual characteristics are now considered medically necessary interventions for many transgender persons. Prior to this kind of surgery, the person usually goes through a long period of hormone therapy which attempts to suppress same-sex characteristics and accentuate other sex characteristics. For instance, males that have gender identity disorder will be given the female hormone, estrogen. The estrogen causes the male breasts to enlarge, testes to become smaller, and body hair to diminish. Females with gender identity disorder will be given the male hormone, testosterone, to help them develop a lower voice and possibly a full beard. Following the hormone treatment, the adult will be asked to live in a cross-gender role before surgery to alter their genitalia or breasts is performed. A team of health professionals, including the treating psychologist or psychiatrist, medical doctors, and several surgical specialists, oversee this transitioning process. Because of the irreversible nature of the surgery, candidates for sex change surgery are evaluated extensively and are often required to spend a period of time integrating them into the cross-gender role before the procedure begins. Counseling and peer support are also invaluable to transsexual individuals. Follow-up. Studies have shown positive results for many transsexuals who have undergone sex change surgery. However, significant social, personal, and occupational issues may result from surgical sex changes, and the patient may require psychotherapy or counseling. Speech therapy may help individuals use their voice in a manner more appropriate to their preferred sex. 3.8.1 Action Steps in Treatment for Gender Identity Disorder. Treating gender identity disorder can be a slow and complicated process. With gender identity disorder, better recovery outcomes are associated with early diagnosis and treatment. Step 1. Identify and challenge negative thoughts about one's biological sex. First, identify any negative thoughts that are being had in regards to one's gender. For example, a male suffering from gender identity disorder may say, "Men are pigs. They are crude, crass, and uncaring. Unlike me, men are athletic and sportsmanlike. Men don't enjoy art and fashion." Look at these negative statements and note if there are any lies or half-truths that are being said. For example, many men are not crass, are unathletic, and enjoy art. Step 2. Find ways that one can identify with one's biological sex. A person with gender identity disorder generally believes they cannot identify with their biological sex. Assess what things are present in one's lives that do correspond with their biological sex. For example, a woman suffering from gender identity disorder may feel that she does not identify with cosmetics. Note these similarities and continue to identify things that one does have in common with others of the same biological sex. Step 3. Neutralize physical issues. Some persons with gender identity disorder have genitalia and secondary sex characteristics in line with their biological sex, meaning they have physically developed normally. However, others may be experiencing either ambiguous genitalia or a hermaphroditic physical condition. If the latter is present, consider that even though one's external appearance is different from the average person of a particular sex, genetically one is always fully male or fully female. This male or female designation does not occur in one's phenotype, the way their body looks externally. It occurs in their genotype. Whether they present XX or XY chromosomes, confirming one's gender based on genetics and considering outward biology as only secondary, may be an effective tool in reframing thoughts about gender identity. 3.9 Summary. Gender may well be the most basic thing in the elements that make up human personality. In fact, gender is so basic to our identity, most people mistakenly assume our sense of being male or female is defined with absolute certainty by our anatomical sex. Contrary to popular belief, one's sense of gender and one's anatomical sex are two distinct elements, each developing at different times in different parts of the body. Gender identity disorder is a real and serious problem. Although we don't know all of what may be the cause or causes of the problem that these individuals feel toward their assigned sex, we can be reasonably certain that it is connected with either a congenital irregularity, an irregularity that occurs in the first few years of childhood, or some combination of the two. We also know that every individual's sense of gender, once established, is unchangeable over the individual's lifetime. If the individual's gender dysphoria is a relatively minor one. Cross-gender lifestyle changes in periodic dressing and behaviors may be all that is necessary to ease the anxiety. However, if the individual's dysphoria is profound, a lifestyle change may be insufficient. In this latter case, gender expression moves from a lifestyle problem to a life-threatening imperative. Thank you. Subscribe to our channel for more updates, and we will see you with the next chapter.